Okay. Now we are starting the second panel of the conference, and the topic of the panel is healthcare immigration and oncology nursing. And this topic will be very complementary to the Professor Bakın talk. This is a very important topic and that affects healthcare services everywhere, regardless of the country where the nurses migrate from or nurses migrate to. Yes, of course, the effect of the migration is not the same, but it is a global problem and it needs a collaborative solution. In this panel, we have 4 speakers. Ms. Enyo Bosumprah from Ghana, Professor Sevilay Celik from Turkey, Dr. Rima Saad from Lebanon, and Mr. Melvin Miranda from the Philippines. And our speakers will be talking about the nursing workforce and the staffing in their country. And they will explain how this affects nursing care. They will also share the data and information about the nurse migration in their country. And I believe that our participants will want to join the discussion on this topic at the end of the panel. So if you have any question, please use the Q&A box and send your question, or you can use the chat box for your comments. Since Ms. Enyo have some internet connection, now I will continue with the Professor Sevilay Celik. It's okay. And Professor Sevilay Celik is a faculty member at the Koç University School of Nursing. She has been in Malta, US, and Poland as a trainee, visiting lecturer, observer, and researcher. Her main area of research interest is surgical nursing, including thoracic, cardiovascular, and urology nursing. Also, she is a board member of the Turkish Nurses Association. Please, Professor Sevilay Celik, floor is yours. Thank you for being us today.
Thank you very much, dear Gülcan. Firstly, I will share my slide.
Yes, please.
Please. Okay. Thank you again. First of all, I would like to thank you for giving me this opportunity. I have brought hello from Turkish nurses. Firstly, I want to show some pictures of my country's oncology facilities. In my country, cancer is second most common cause of the death after cardiovascular disease. We have 500 cancer treatment center providing oncology services. In addition, these centers, Turkish nurses work in clinics, intensive care and palliative care units where the adult and pediatric patients are treated and cared for cancer. And these pictures from Istanbul. After ending of my slides, I will continue my speech. Please. Okay. Firstly, I want to give information about nursing workforce in my country. There is a shortage of nurses in Turkey. According to current data, my country is falling behind many countries with 24 nurses per 10,000 individuals. Although my country's need for nurses has become drastic, we still have thousands of nurses waiting for their job assessments. However, experience in Turkey have shown that there are problems in finding nurses in the number and quality to meet the needs of cancer patients. It is affected, the number of general nurses as well as oncology nurses is limited and low. In addition, the number of nurses who have received oncology nursing certificate, including chemotherapy certificate, is only 626 nurses nationwide. This number is also dramatically low. In addition, in my country, the ratio of nurse-patient varies between 3 and 6 in palliative care and intensive care units, between 10 and 20 in clinics and in the chemotherapy units. The studies conducted in Turkey show that nurse shortage has many negative effects on patient, nurse, and institutions. These negative effects can be listed as the increased rate of patient falling out and post-drug administration, hospital infection and mortality rates, pressure ulcer, and the prolongation of hospital stay. In addition, it is shown that the nurse shortage causes physical, emotional, and social problems for nurses due to their heavy workload and to change institution very often. Unfortunately, there is no up-to-date official data on the migration of nurses in my country. In a study conducted by Turkish Nurses Association with 8,274 nurses, it was shown that 77% of the nurses and 73% of the oncology nurses wanted to work abroad. In addition, about 18% of oncology nurses said, I am trying to meet the necessary requirements for application to go to abroad. The person said, my application has been accepted. The person said, I applied and I am waiting for the response. And 18% said, I am learning foreign language. For now, although the migration of nurses seems low in my country, I foresee that this number will be much higher in the next 5 and 10 years if necessary measures aren't taken to prevent migration. In the same study conducted by the Turkish Nurses Association, it was shown that about 56% of the nurses wanted to go abroad due to economic problems, 26% due to psychological and physical violence, 49% due to perception of worthlessness, negative working condition, workload, and 37% of them due to political problems in country. The majority of nurses state they want to go to European countries such as Germany, Italy, the Netherlands, the USA, and Canada in order to perform their profession in better working condition and to give more good. That is, dear Gülcan, for time being, thank you.
Thank you, Professor Celik. I will come back to you again for the other question. And thank you for sharing the data regarding the nurse migration and the intention of the nurses about the migration in Turkey. I know that it's not an urgent problem right now, but it will be really urgent in the future in our country. Thank you so much. And now I would like to invite our second speaker, Dr. Rima Saad. Dr. Saad is a project coordinator, global nursing for the Department of the Global Pediatric Medicine at the St. Jude Children's Research Hospital. She is a certificate pediatric hematology oncology nurse with the 15 years clinical experiences at the Children's Cancer Institute in the Lebanon. and received her PhD in nursing science from the American University of Beirut. Please, Dr. Saad, floor is yours.
Thank you, Gülcan. And unlike in Turkey, I think nurses migration in Lebanon is a pressing need and pressing topic to address. So I will go ahead and start with the slide showing proudly that I am from the Children's Cancer Center of Lebanon, where actually the center hosts the biggest or the largest number of patients in pediatric oncology in Lebanon. And here are some pictures from the center and from the team. And unfortunately, many of the people showing in these pictures, the nurses, colleagues, have left the country already. So globally in Lebanon, we have seen an increase in oncology cases, almost like 5,000 in a few years, reaching currently 11,500 new cases per year, speaking adult and pediatric oncology, and specifically pediatric oncology has doubled in 5 years due to influx of refugees also from the surrounding countries. And we have a developed healthcare system that is called Lebanon is the hospital of the Middle East. And it's pretty much advanced in medical care and nursing care. And the hospitals caring for oncology patients are more localized in big cities mostly. Some hospitals are available in peripheral hospitals, and some care is also provided in private clinics. So talking a little bit about numbers, the nursing workforce in Lebanon, the current workforce is actually around 11,500 nurses. And this means that within a country of 6 million or 6.7 million population, the ratio of nurses to 100 to 1,000 patient population is 1.6, which is very low compared to other higher income countries. And when we talk about the oncology nursing, as Dr. Gülcan said, there are a lot of challenges that are faced in oncology. Particularly, we see in Lebanon improper distribution of specialty nursing in different hospitals. We see low enrollment in the specialty and in nursing in general, and low retention rate of nursing. In addition, the nurse-patient ratio varies a lot among institutions depending on the resources available. And we cannot stress much on the level of distress that oncology nurses face in dealing with patients due to the complexity of the care. And we have seen actually high migration rates since years in Lebanon. And that was because of all the described reasons. And that was before 2019. And after 2019, with the cascade of crises that happened in Lebanon, starting from the revolutionary movements in 2019, to the COVID-19 pandemic that hit all the countries, to the Beirut blast that was in August 2020, and to the crisis, the economic crisis that's happening currently in Lebanon. All these have led to an unprecedented nursing migration. And according to the Order of Nurses in Lebanon, we have around 2,500 nurses who migrated since 2019, which is really a very high alarming number. And as in the first presentation by the WHO, it's around 30% of the nursing workforce in Lebanon. And it may be more because these numbers are depending on those who request a certificate from the Order of Nurses. And about the reasons for leaving, obviously, nurses may have unsatisfactory work conditions, unsatisfactory salaries or benefits packages, and poor work conditions. and lack of job stability. But when I asked nurses who are working in the field, their answer was that they want safer environment for their children and their families, and they want better conditions of living. So that was the situation from Lebanon in terms of nurses migration, and looking forward to hear other experiences. Thank you.
Thank you, Dr. Said, for sharing the situation in your country. And we can see that the reason is common, but also there was some safe issue, and it's really sad because our colleagues wants to migrate because of the safe, not just for fun or for better income. It's, of course, it's also not acceptable, but this is another issue we need to think about and discuss on. Thank you so much. And last but not least, I would like to invite Mr. Melvin Miranda. And Mr. Miranda has been from Philippines. Mr. Miranda has been in nursing education for almost 20 years. He is the present dean of the College of Nursing in Marina Central University since 2013, where he also earned his Bachelor of Science in Nursing degree and Master of Art in Nursing major in Administration and Supervision. Continuing in the professional advancement, he has completed major courses in the Doctor of the Philosophy in the Nursing Education, major in Leadership and Management in St. Paul University, Medina. Thank you, Mr. Miranda, for being us today. It is really important to have you here in this panel because, you know, Philippines is in the center of the migration of the healthcare professional. So we are looking forward to hear your talk.
Thank you very much, and good evening here from the Philippines. So I'll just share my screen now.
Yes, please.
So as had been introduced, I'm Melvin de Miranda. I'm the National President of the Philippine Nurses Association, and PNE is a member of the International Council of Nurses. I'm the Board of Trustee of the Philippine Federation of Professional Associations here in the Philippines. I'm also an NOMLEC of the Association of Deans of the Philippine Colleges of Nursing, and yours truly is the Dean of the College of Nursing of Manila Central University, College of Nursing, Philippines. So our topics related to the health sector, migration, and oncology nursing, and on the perspective of our country here in the Philippines, we'll consider the some issues pertaining to the experiences and the governance of the health sector and oncology nursing in the country, simply because in some other countries, we've considered an established career progression and specialization framework. But here in the Philippines, it is still ongoing on how we pursue this career progression, specifically on the oncology nursing. And the topic, other topics that I may consider also as with the discussion is related to the migration of the Filipino nurses who have been deployed in countries abroad. One of the concerns that had been not actually a concern, but opportunities that provided our Filipino nurses when it comes to oncology nursing is that of it considered our chief nursing officers or chief nurses of our hospitals on how our Filipino nurses will be engaged into the advancement. And due to the pandemic in the last 2 years, it engaged our nurses to have competence through their professional development. So most of our nurses who are engaged in oncology units had been trained accordingly to the advanced infection prevention and control management. Our government have supported through the Department of Health. We have our DOH Academy where nurses can access on how they will be trained accordingly, even though it's on an online delivery, but this provided already the Filipino nurses to have the advanced skills in the infection control and prevention, basically on the attending our patients in the ward, specifically in the oncology ward. And when it comes to the advanced epidemiological investigation research, when COVID-19 is continuously increasing in number in 2020, our nurses have been involved in the community community investigation on specifically on those who may have pre-existing illnesses and comorbidities. So because they have been prioritized to be considered as a priority population for vaccination. Other than that, here in the country, we have considered here in the Philippines the contribution of our nurses when it comes to the human health resource management, because most of our nurses are placed or having their formal workstations in the hospital. So we are really lacking those nurses in the public health and serve those who have cancer and those who must receive the extensive care for palliative. Then number 4 is our nurses have given the opportunity with the nursing and health informatics, and this concerned also on how our nurses have been immersed into the trainings, still attending to those patients in the communities through the telemedicine, through the teleconsultation. Nurses have been involved into these various innovative measures on how to still reach our patients in the communities. And in the local and the national issues, we have also oncology nurses that have been part of the problem when it comes to the shortage here in the country, because most of the specialized nurses here in the country are gearing towards for their application abroad because of the competitive compensation and salaries that are being offered. Being in the third world country, the Philippines as of now are still ongoing on the establishment of our salaries and compensation for the private and the public sector. Number 2 concerns pertaining to the issues of our nurses in the country, which is related to the migration, is the compensation and the benefits, because for now we have different scheme of the benefits and compensation for the private and the government sector, which considered our nurses to shift and have their transition of their work in the private and the from private sector to the government sector, and some of them have geared towards application abroad. Third concern is related to the positive working environment, which considered on how our nurses are vulnerable when it comes to their workplaces. And with the geographical locations where nurses are being deployed in the country, they have been assigned into far-flung areas, and usually in geographically isolated disadvantaged areas where there are facilities wherein it is attended by one nurse, and because we also lack doctors in the communities. So if we have most of the patients on palliative care with cases of cancers in the community have been attended by one nurse for a population of almost 5,000 population, and with the cases of the 5,000, it identified already those who are at risk of 1,000 and those cases with 50. So how a nurse can manage eventually those concerns. So these are the concerns when it comes to the safety and security. When it comes to the deployment and migration, this is one of our concerns now, simply because of our concern with the compensation and benefits, and some of the nearby countries, even in ASEAN, even in the Europe and the US, are offering job placements and opportunities for Filipino nurses. And indeed, there's a big disparity, major disparity when it comes to the salary in our country and those that are being offered abroad. So it really affects basically on the distribution of estimate of human resources for health in the country. As of the moment, as of the December 2021, we do have 617,898 of the licensed practicing nurse in the country. But if you see, there are concerns pertaining to the migrant health workers. We have from the 617,898, the migrant health workers is already 316,405. And there are also human resources for health of nurses with unspecified practice of 124,999. So if we will try to consider our figures, the number of our practicing nurses in both the private and the public health facilities is only 172,589 out of the total number of the 617,898. So a higher percentage wherein our nurses have been deployed working abroad. And with these figures of our distribution of manpower by area of practice, with the private, we have already 36% of our nurses who are already working in the government institutions, and 35% are in the private sector. And if you will see, if you will try to consider the cases on how our nurses will attend to our patients with cancer across the lifespan and invalid setting, our concern is with the number of nurses being deployed in the LGU or the local government units, field health facilities, specifically the specialty clinics and areas. And deployed in our rural health units are only 12%. So these figures are very alarming, simply because of our concern with the manpower in our public health and communities. So with the number that we have of the total demand, we have almost with the number of 301,944. But if you will consider the supply, we have 617,898. So the question is do we have a sufficient number of nurses in the country, or do we really have a problem with the shortage of nurses in the country? But from the figures that I have presented before, the concern is that of almost the 300 plus are already identified as migrant health workers. And with this 617,898, with the demand of 301,944, our present workforce is already 172,998. So it seems that we really have a problem with the workforce in our country. So that's why the government is already calling our organization on how we will consider the campaign for our nurses to retain their work here in the country. So with these figures, we have considered from our Professional Regulation Commission of the entire workforce with the midwives, nurses, and medical doctors, almost 73% that we have already of the total number of workforce in the country, which considers nurses as the front line in every healthcare setting. And indeed, our graduates of the medical and allied health workforce from the 2015 to 2020 is decreasing from 2019 to 2020. So this may not support specifically on the number of our nurses. And those factors that have been considered in this concern is that of probably in the availability of the resources in various regions. And if you will have this data on the enrollment and graduates of our in the BSN program, we have an increase in the number of the enrollment of in the nursing program of 108,332. But seemingly, if you will try to consider in our graduates, we only produce 7,204. So there's a major difference when it comes to these figures. So are we having a problem pertaining to the nursing workforce? Definitely with these figures, yes. So with these figures also of the passing of the nurse licensure examination, at present we do have in 2017 to 2021, we have 537 nursing schools, which is distributed all over the country. But with the number of examinees through this number of years, we have 93,782, but only pass is 44,404. The next question is that of where are these 44,404? Higher percentage of the, with the percentage of 47.35% with the number of the examinees. With the one of the questions that have addressed to me is the 44,404, where are they now after those years? So as based from the data of the 2021, I have presented to you that almost 300,000 plus of our nurses have already deployed and worked abroad. So this is also a problem with us because in the 2021 during the pandemic, 2021 and 2020 we did not administer the nurse licensure examination, and during this time there were concerns that arise when it comes to the nursing workforce because we have not produced our registered nurses, our professional nurses during the 2020, and we just only started the nurse licensure examination during the time it is the pandemic regulations. And if well, with the support of the government, we have considered the deployment of our nurses in various regions. If you consider with the other cadres, we have physicians, we have also dentists, pharmacists, medical technologists, nutritionists, and midwives. The nurses has done a high number of the nursing workforce for each region, because seemingly we are really identified in the front line. And this also concern when it comes to the oncology nursing. We have identified that those cancer patients will really need our services in the community. So that's why the Department of Health considered this measures on how we will still attend to these concerns. So if you will try to see in these figures, the total of the human resource health for all the cadres is we have 21,601, and the total number of nurses that we have is 15,530. So this is a very significant figure on how our nurses is really important to attend, to extend the services to our patients in the community, specifically with our cancer patients who may need palliative care.
I'm sorry, Mr. Miranda, to stop your presentation, but to have more time for the discussion and for the others speakers. Can you summarize, or we can stop here and then you can give this information and share the information with us while you are answering the discussion question, if it's okay?
Yes, ma'am. It was actually the last slide. Thank you very much.
Thank you. Thank you so much for sharing very detailed information. As I said earlier, Philippines nurses are everywhere, and they are in the center of the migration. And now our last speakers, Ms. Enyo, is with us here. I would like to invite Ms. Enyo Bosumprah. Ms. Bosumprah is the principal nurse officer and deputy nurse manager at the Pediatric Oncology of the Corbu Teaching Hospital, Accra, Ghana. She has a master in advanced nursing practice and is a registered pediatric oncology nurse. She recently won the Lifetime Achievement Awards in nursing category at the International Society of Pediatric Oncology Africa 2022. Congratulations on your awards, Ms. Enyo. And please, floor is yours.
Thank you. Thank you. So I'm looking at the topic from Ghana's perspective. Unfortunately, I had internet challenges, so I couldn't join in on time. So for Ghana, I'd wanted to show you where Ghana is located on the map of Africa, and then to show you where our hospital is located in Ghana. It's actually very close to the Gulf of Guinea, and the hospital is a very large hospital called Lebanon Teaching Hospital. We have about 2,000 bed capacity with a child health department located within the hospital. It's actually a very wide hospital. So I actually took a picture of just the administration to show you. So over the years, we have a large nursing workforce. Before 2016, our numbers dwindled so much to the migration problem. Then there were policy measures that were put in for to boost up the number of nurses that we have in Ghana by improving salary, by improving working conditions, like nurses getting a bit of free charges for import of cars, etc. Then around this time, those conditions have gone down due to the economic conditions of the country. So the nurses are leaving massively. When it comes to oncology specific, we have just about 25 nurses in adult oncology who are specialized, even though we have greater numbers who are general nurses practicing in adult oncology. And when you come to pediatric oncology, we have 29 specialized nurses that were trained recently with support from World Child Cancer and then Ghana College of Nurses. So we did only 2 batches. So currently we have 29 nurses in the system, 6 being as our second treatment center, Confanote Teaching Hospital, serving the Northern Zone, and then the Premier Hospital, Kwalebu Teaching Hospital, where we have a comprehensive treatment center, also with 8 of the specialist pediatric oncology nurses. Currently, the rest are scattered over our 5 shared care centers, so that after we have done treatment and the children have to go back to those areas. those nurses are able to take care of them. So over the few years, we have lost quite a few experienced nurses to migration, and the areas they usually will go is UK to US and then Australia. And so the problem has really been challenging, looking at the few numbers that we have, pediatric oncology nurses or oncology nurses together, serving a population of about 32 million. So you see where our challenge is. So for pediatric oncology, we have we used to have a 30-bed capacity, now reduced to 24 due to congestion and then the infection of children. So we decided to reduce it. So nurse patient ratio on the pediatric oncology unit, in the morning shift is 1:6. In the night shift, 1:8 or 7. So it depends. It's not really like one, but we don't have a really hard structure. Depending on the number of nurses available and the patients on duty, but it can go as high as 10, 1:10. Even critically ill patients, you might have as many as 4. So when the nurses migrate, it's really a challenge. For the few that have left, it's been really hard on us because those were the trained nurses that could support the unit that we have left. Thank you.
Thank you so much, Ms. Bosumprah, to sharing the situation in your country with us today. And thank you for being us today, even though you have some internet problem. And now I have some discussion question for our panelists. And my first question is, how has oncology nurse migration been affecting or will affect the nurse who are left in the cancer center and patient care in your country? And also, I want to combine the other question to use the time effectively. Can you please share us if there is any positive outcome of the migration? Professor Celik, could you please start?
Thank you, dear Gülcan. Nurse migration depends the nurse shortage in my country. In this case, it can prevent the delivery of qualified and safe care to patients, cause burnout in nurses due to heavy working condition, and cause nurses to change institutions or early retirement. But I don't think that nurse migration has a positive effect in my country, because in my country where there is a nurse shortage, our most qualified nurses migrate. Further, depending the nurse shortage in my country, in this case, provide the quality and safe nursing services to our society will be hindered, and the gap in the fragile health system will increase in my country as well as in developing countries. However, I can say that our colleagues who went abroad are happy because better living and working conditions. Thank you, dear Gülcan.
Sorry, I was on mute. Dr. Seck, could you please continue with the same questions?
Yes, of course. And I would like to highlight from personal experience and from experience of my dear colleagues in Lebanon. So though it might not be affecting patient care, but sometimes the migration would lead to a lot of effort in doing the training for the new nurses, and particularly coming from the center that I am working currently, we have around 45% of nurses who are new, and these need a lot of training and orientation to get on board. And from the patient perspective, also we see some effect, like emotional effect for the patients who are attached to their nurses. So when they see or they know that they are leaving, they have some, psychological or emotional distress for that. But at the same time, they wish the nurses for the best because they know they're going to a condition that is better. As for the positive aspects, I know it's hard to think of positive aspect, but thinking deeply, there are many positive outcomes of being abroad. First, at the individual level, we can be assured that our standards of care and nursing preparations are at the same level of any international or well-resourced country. So we have a strong nursing education in Lebanon that is validated when we go abroad. And on the other hand, at the family level, nurses who are abroad will send to their family their, some financial support that is currently needed in Lebanon. And at the same time, it might create some contingency plan in case the situation gets worse in Lebanon. There is a contingency plan to probably save or move the family maybe temporary outside. And at the global level, which I think I'm fortunate to have because I am working at the global pediatric department at the St. Jude, it creates like a bridge. And knowing the country or knowing the region is very important when we want to respond to the need. So allocating the resources that we have access to from working in international centers like St. Jude will help us really allocate the resources to the needs of the centers of the countries and of the region. So being a bridge is also one of the positive aspects of having migrating nurses. Thank you.
Thank you so much, Dr. Said, also pointing out the positive. Yes, of course, maybe it's not the direct positive outcome for the countries and the healthcare services, but at the end, starting from the individual level, it will affect positively at some point, hopefully. And Mr. Miranda, same question for you, please.
Thank you very much. Here in the country, we have our specialty organization. Aside from the PNA, we have the Philippine Oncology Nurses Association, which provided the services for our nurses when it comes to their need of trainings and when it comes to the enhancement of their knowledge and skills. So this considered on how our nurses will continue to have their engagement in the professional development. However, most of our nurses who have been deployed abroad are those who have been assigned in specialty areas. If we are talking about hospital settings, those nurses who have the high competencies when it comes to taking care of patients, specifically for cancer patients, they are the ones that have been offered to have this career opportunities abroad. I know for a fact that these opportunities is definitely for professional development, and we cannot control our nurses to be out of the country. However, we are doing our ways and possible means to coordinate with our government together with the organization such as DEPONA to prepare our future nurses and have the engagement, particularly in the trainings on how they will develop the competencies. And since there is actually considering positive outcomes, when it comes to the positive outcomes of the migration, we have embraced challenges. So embracing these challenges is pertaining on how we will have the support the families who are taking care of cancer patients in the community by provision of the strengthening their support, strengthening their skills on attending to the patients, even though we do lack the manpower in the communities, but empowerment of our people in the community is one of the key factors on how we resolve these concerns. Other than that, we have bridged already some of these concerns on how we will strengthen nursing education, on how we prepare our students to be engaged to serve the country, specifically on the endeavors of taking care of our patients in the communities. Thank you very much.
Thank you so much, Ms. Brenda. You already answered the question regarding the solution also. So thank you so much. And Ms. Enyo, please, same question for you. Can you hear us?
Yeah, so for us in Sub-Saharan Africa, or talking for Ghana, the positives are so much. In the first place, in Ghana, we have a lot of nurses, that backlog of nurses, not only nurses, but many health workers that have finished training, but they are not able to get jobs. So when this, and the pull factor, or the places that the nurses are traveling to, they always ask for experience. And so it is only the experienced nurses that are traveling out. So when the experienced nurses travel out, it creates vacancy for the new nurses to be employed, or other health workers to be employed. So that is the number one positive. It also helps foreign exchange, because our currencies are not so strong. So when the nurses go abroad, we have an extended family practice. And so one person who is earning salary has a lot of people that they are attending to. You do not collect your salary and spend it alone. You have a lot of other family members aside your nuclear family that depend on you. So these nurses go out and they are able to remit their extended families on regular basis. So it also brings down poverty for those families. And when the nurses do come back, because we have had situations where some nurses return to their countries to come and practice again. So they bring back very hard expertise, to high expertise, to come and work in our facilities and improve our facilities. They themselves, their economic situations are improve a lot. So these are some of the positives that migration gives to our country, or Sub-Saharan Africa in a whole. Talking about the solutions, we only have to improve conditions of service, because a lot of these nurses are going out because the salaries they take home does not take them even for a week. So people want better conditions of service. So if they are given better salaries, their government restructures as they did previously, I'm sure a lot of nurses with car loans, housing facilities, these are the basic things that the people are looking for. So once the government is able to put in measures to be able to provide soft loans for cars, soft loans for housing, I'm sure that the nurses migration will come to, at least, if not stopped at all, it will come to a very minimal level. Thank you.
Thank you, Ms. Enyo, for sharing the station. And my last question is about the solution, actually. Could you please tell us about the solution? Have you any solution for nurse migration in your area, or any suggestion for the future? Professor Celik.
Thank you again, Gülcan. I don't think there is any solution that the government has made in this regard to eliminate the nurse immigration, because adequate and effective solutions are not produced to eliminate the reasons for nurses to migrate to a foreign country. Turkish nurses still live on the poverty line, work with long and heavy workloads, and their working conditions are not enough at international standards. To minimize nurse migration, governments needs to invest nursing education, the nursing profession, nursing leadership, the delivery of nursing services, and the safety, health, and well-being of nurses. As a result, it is vital and urgent for governments to stretch their capacity to collect, analyze, and act on data about our government's nurse and health workforce. In addition, it is necessary to monitor nurse mobility and migration with ethical principles and responsibility for the existing nurse migration. Thank you, Gülcan.
Thank you so much. Ms. Saad, yes.
Yes, from Lebanon perspective and through a discussion with the Order of Nurses, there are some recommendations that were raised at the national level, and many of them where they have started working on, like demanding decent working conditions and package for benefits. Also raising the national standards for retention strategies in the policies of nursing work. And also there is a law that they are trying to implement regarding the roles and the competencies of nurses and the different work conditions related to each level of nursing work. And definitely encouraging nurses to participate in projects and innovative research, clinical projects would definitely motivate them to be on the ground working at the same time, making a difference in the patient care. And on the national level, also implement strategies for defining mandatory national education for the various levels of nursing, so including structure of the team, who should be in the team, and the roles of the different team members, including the nurses at different levels. So these are in brief the points that we have from Lebanon. Thank you.
Thank you so much. Since Mr. Miranda, you already shared some solution to use the time effectively, please. I would like to continue with Ms. Enyo. But I will ask you again if you have any take-home message. Ms. Enyo, can you hear us?
Yeah, so to add to that, I think the encouragement of nurses to pursue postgraduate courses, because in Ghana, it looks like you are a nurse, what's the need for doing a postgraduate program? Or even when you go to do the postgraduate program, it's like, it doesn't mean anything to your facility, so you keep it in your pocket and then you continue to work. But if nurses are encouraged to do with scholarship, to go for postgraduate programs, and then encouraged to stay in the facility, and then the postgraduate program is recognized in view like increasing salaries for the reason that the person has attained another certificate, it will encourage a lot of nurses. So my take-home message for government is that they should improve conditions of service for nurses. Once they have the basic necessities of life, a lot of people will not want to go, because it's not like it's not a luxury for you to move out of your comfort area to another person's area. So if government is able to work around conditions of service, you can be in hospital as a nurse and you pay for everything from A to Z. So if these conditions are worked on, I'm sure that nurses will stay behind in their countries and help take care of their sick individuals. Thank you.
Thank you so much. I would like to thank you to all our speakers. It was a great discussion and great information from the different countries. And I would like to ask my colleague Margie if there is any question from the participants. Maybe we can have just one.
There's one question. There's one question in the chat. Is there a significant number of nurses refusing to receive COVID-19 vaccine, or shortage of nurses due to vaccine mandate? So maybe our panelists can answer quickly, or maybe they can respond to the question in the chat.
Yeah, it is. I know it's an important topic, but maybe not directly related to our topic. Maybe if you, all of our panelists, type the answer to the chat, and we can see the answer. And again, we already overrun the time. I would like to thank you to all of our panelists and our participants. I think we need to have more time to discuss about this topic. This is very important, even though it's not maybe right now urgent problem for some countries, but it's absolutely urgent problem. And as a conclusion, maybe as a take-home message, maybe we can, for GPON participants and the panelists and speakers, invite the government to rely on the WHO solution for the nurse migration. And these are establishing a safe and good working condition for the healthcare professional. And yes, of course, all the governments we need to invite them implementing the code of the practice on the international recruitment of the health professional. And my personal take-home message is I hope the healthcare professionals want to migrate to somewhere else just for fun, just for adventure, not just for safe, better condition, better income, or other station. Thank you so much for your time.